We are here talking with Dr. Rosa Bell, a board-certified neurologist here at Neurological Care Center in Montgomery and now open in Prattville. Congratulations, Dr. Bell.
Thank you, Leanne, and thank you for having me today.
Well, you'll be able to service and super serve so many more of your clients who come in to get help. And today is about concussions.
Yes.
But before we talk about concussions, first tell us about yourself, your credentials, and your practice.
Yes, I have been here practicing in Montgomery since 2000. I went to both undergrad and medical school in Tennessee. I went to medical school at the University of Tennessee. I did an internal medicine at Kettering Medical Center. Then I did my neurology residency at University of Cincinnati, and I did a clinical neurophysiology fellowship at Cincinnati and Children's.
Wow, my goodness, lots of credentials. So I understand that you have a special interest in concussions. So kind of tell people, what is a concussion and who is affected?
Yes, a concussion in simple terms is a biomechanical injury to the brain. And biomechanical because you don't have to have head trauma to have a concussion. Anything that hits the body that causes the brain to shift in the skull.
So a lot of people who are affected are athletes who do any sport, really, not just football.
Exactly. Soccer, football, rugby, hockey, basketball, so many sports are affected. And what has become so important about concussions is now we know more. We know more about the neurometabolic cascade that happens in concussion and what's happening on a cellular level.
Well, as a parent, I know that, it's so scary to put your kids in sports. Of course you want to because you want them to play and learn and learn those, but you also have to keep them protected and educate yourself. So I'm excited that we're talking about this. Tell me about your concussion device that has been patent published.
Yes, I'm very excited to speak about that. The device, actually, what I just said about what we know more about with the neurometabolic cascade, it actually looks at brain activity and it looks at it on the cellular level. What we do with an electroencephalogram, which is a big component of it, it is called the Bell Brain Trauma Assessment System. And so we take the brain waves and we see changes in brain waves that suggest concussion. Because what we've learned neurometabolically, what is going on is the actual cell loses its balance. So we can see those changes in the brain waves. And what we do is we get baseline brain waves, so we know what the brain wave looks like on the athlete, for example, when they have no head injury. And then if we get a concussion, we see those changes. Also, we then do it after because we want to make sure they're recovering from the concussion.
Exactly, because it is important to take that time to recover. So what is CTE?
Well, CTE is chronic traumatic encephalopathy. It's a neurodegenerative condition that develops after repeated head traumas and concussions. We don't know which actually affects it more. Is it more concussions or head trauma? But we know both are involved. And what we've learned with the cellular level of concussions is when the cell does not go back to its baseline, your brain cellular activity, the brain activity, that it leads to permanent damage. This is why it's so important to determine if a concussion has happened and to also make certain that the person has recovered from the concussion.
Because if you're still, going back and participating in whatever caused the concussion and you're not recovered yet, is that where the permanent can happen?
Exactly. There's two big components to that. When you go back and you have not recovered from the concussion, you're not able to cognitively function. Your physical abilities are diminished after concussion. So the likelihood of you getting another concussion increases by 72%.
Wow.
In addition to that, if you go back and you get additional brain trauma, then the likelihood of the brain being able to recover lessens, and then they go on to develop permanent brain damage. Also, with the children and the adolescents that are athletes, all the studies have shown us that they lose, it's called neuroplasticity, that's their ability for their brain to recover from injury. After repeated head traumas, they lose that ability.
My goodness, and that's where the permanent issues
Yes,
come
and
in.
the youngest person with chronic traumatic encephalopathy that we know of was 16 years old.
My goodness, that is so young. Just getting a driver's license. I heard
Yes.
that, sweet 16 and getting a driver's license. So tell me how this technology is benefiting student athletes before and after a concussion. Really specific why it's so important to come in and maybe get that baseline if you're a student athlete in a sport that is known for concussions.
Yes, this is what's so exciting about this. If we can get the baseline, we can then know what the brain looks like when there's no injury. Then we can also get the brain waves if a concussion happens, see the changes. Then we can monitor those brain waves and in serial monitorings and see if the person has recovered. So the person does not return to play. The American Academy of Neurology, as of 2013, unequivocally said, if you have a concussion, you should not return to play until you have recovered. So it will make certain that the individual has recovered and that it is safe for them to return to play.
Well, and you're not going to know if they're 100% recovered unless they come in and get that baseline, that initial
Exactly. That
scan.
is so important. That is so important. Up until this juncture, we didn't have anything objective to assess concussions. We were just going by physical exam findings, neuropsych testing, but this way we can actually look at, no one can fake it, no one can change the parameters of it, no one can change the outcome of it. It's all what your brain function is doing.
So Dr. Bell, tell me about your concussion device that has been patent published.
Yes. My device, we can assess brainwaves subjectively. We can get the brainwaves within 5 minutes. I know of no other device where we can look thoroughly at the brain with 22 electrodes and get brainwaves within 5 to 10 minutes. In addition to that, we can also analyze and compare to the baseline brainwaves in seconds and look for those subtle changes that suggest concussion. We also have found that we can find more ominous things like a brain bleed as long as there's 1 milliliter of blood or more, and people don't have to get the CT scans and be exposed to radiation. So that's another thing that's very, very important about this device. In addition, we can get the brainwaves after and look for recovery. One of the things that we're also interested in is finding and diagnosing CTE ante-mortem instead of post-mortem, so we can use some of this data also to look for changes that suggest CTE in the future.
So if coaches or parents or student athletes of age want to learn more, want to come in and maybe get a baseline scan, want to just come in and make sure that everything is functioning the way that it's supposed to, if they've recently had a concussion, how can they get a hold of you in your office?
They can call my office and ask for an appointment. They can let their primary doctors know, and they can refer them for the appointment, but they can just call the office, and they can also go on my website, drbell.net, and look at different things about concussions and what we've done with concussions.
Concussions are in the forefront, especially with the NFL and, talking about seeing the consequences of consistent concussions. So it really is so important to educate parents because it starts young, so we really appreciate you taking the time and educating us on concussions, the importance, and all the information is on the screen if you want to get a hold of Dr. Bell and learn more and get those scans done right there on the screen for you.